what is varicose vein? What are the causes of varicose vein? How will you diagnose varicose vein, and what are the treatments of varicose vein? We'll be discussing these four headings in this short video. So welcome to my channel. My name is Aksh Patel, and today we'll be discussing about varicose vein. So without wasting the time, let us start. So first of all, what is varicose vein? So definition says it is the dilated and tortuous superficial veins. Now, what are the superficial veins? The superficial veins are actually blood vessels that carry carbon dioxide in the blood, and they are located just beneath the skin. They are the superficial veins. And when these veins are not functioning well, when these veins become dilated, when they become big, they, of course, common sense tells they get appear on the skin. So here you can see these are the dilated and tortuous vein. This is varicose vein, isn't it? The diagnosis is very simple. Like, the diagnosis is mostly clinical. You see a leg of a person and you just tell he or she is having a varicose vein. Yes, but that's not the case, because varicose vein can be due to multiple reasons. And to find out what is the cause of this varicose vein is very important. And there comes the diagnosis. But before the diagnosis, let me tell you how a normal body functions, like how vein transports the blood. So let us see that. So I'll be drawing a schematic diagram, and through this schematic diagram, you'll understand like how varicose vein takes place. Okay. So before that, let me tell you, uh, this is how a superficial and deep vein looks like. The blue color is a superficial vein that is just beneath the skin. And those superficial vein, the veins which we are concerned with are great saphenous vein and small saphenous vein. So these are the two main superficial veins. Okay, so this blue one, which you can see, is a superficial vein, and this purple one is a deep vein. The deep vein means it is situated deep inside the body, between the muscles, between the fascia, between the deep fascia. Okay, so before getting into the cause of varicose vein, let me tell you that these superficial veins are not that much important to the body. Like, if you remove these superficial veins, the body is not going to have anything. It can function very well. Okay, so let us come to the schematic diagram. Okay, so as you have seen, we have one deep vein, one superficial vein. Let us draw that. So this is the deep vein, deep inside the body. Okay, let me draw it more accurately. This is the deep vein, this is the superficial vein, and then you have this connection in between. You have this connection. Okay, this one is superficial vein, this one is deep vein, and then you have connection in between. Now what happens is that there is one junction where superficial vein meets deep vein, other than perforator vein. So I mean, the connection which you can see here, the connection which you can see here is known as perforator vein. The perforator vein means connection between deep vein and superficial vein. So let me write over here, this is perforator vein. Now, other than this perforator vein, there is also the main connection between superficial vein and deep vein. That main connection is known as junction. Okay, so here you can see this is the superficial vein, right? So this deep vein goes upward and upward, and this superficial vein gets curved, and finally it gets connected to the deep vein. Okay, so this is known as junction. Now let us consider that this is the deep vein and this is superficial great saphenous vein. So this junction will be known as saphenofemoral junction. Saphenofemoral junction. Now, what happens in varicose vein? Let us see. There are four mechanisms, identification of which is very important, and that's what diagnosis is meant for. Okay, so there are four mechanisms through which varicose vein takes place. One is, so before that, let me draw something else. There are the structures in vein known as valves. Okay, so these are the valves. What is the function of a valve? So valve prevents the downward flow of blood. Suppose if the blood is going like this, suppose if blood is going like this above, so it should not come down. Yes, it should go to the heart. Heart is above. I'm talking about the legs. So blood should go above. These valves prevent the backflow of the blood. Okay, so normally goes above. Same in the perforator as well, there is valve like this. So blood normally goes from superficial vein to deep vein. Blood never goes from deep vein to superficial vein. Okay, and if it goes, there is a problem. Generally, blood goes from superficial vein to deep vein. So there are two ways through which blood goes from superficial vein to deep vein. One is through this perforator, and another one is through this junction. Now, there are four ways through which varicose vein takes place. One is, what if there are no valves? If there are no valves, that means blood will come down. Okay? If blood will come down, it will get accumulated in the vessel. And once it is accumulated in the vessel, the blood vessel will get dilated because blood vessel is an elastic material, right? So absence of these valves, it can be either congenital. Congenital means right from the birth itself. Second one is, what if there is problem at the junction? Normally blood goes from superficial vein to deep vein, but if there is a problem at the junction, blood will go in an opposite direction. So that is the second problem. Now the third problem is, what is if the problem is in a perforator? Blood normally goes from superficial vein to deep vein, but what if there is a problem in the perforator vein? Blood will go from deep vein to superficial vein. And now the fourth problem is, what if there is a problem in this whole deep vein? I told you that even if we don't have superficial vein, it's okay. But deep vein has to be present. Deep vein is very, very important. So what if there is problem in deep vein? So these are the four mechanisms through which varicose vein takes place, and I'll explain these four mechanisms in detail. Okay. So even if there is a problem in one, like through one mechanism, what will happen is that this superficial vein will become enlarged. Yes, the superficial vein will become enlarged, and that is visible from outside, and that is varicose vein. Okay. Now let me explain you in detail the causes which I've explained you earlier. So causes can be divided primarily into, basically into primary cause and secondary cause. Primary cause means one that is present since birth, and that's what we call as congenital problem. So I've told you earlier that congenital defect in valves, congenital absence of valves. The valves are not functioning well, valves are not present at all. Those are classified as primary causes. Secondary one are proximal obstruction. OBS means obstruction. So proximal means above, not below. Below means distal. So what if there is something blockage? There is blockage here. So if there is blockage here, blood will not able to go up. If blood is not able to go up, then it will get accumulated all over here, and it will be appeared to us as varicose vein. Okay, so there is proximal obstruction, and in which cases proximal obstruction takes place? One is in pregnancy. This is the most common case. You have baby in the womb, and that will press the vein. So if it is pressing the vein, blood is not able to go up, and that will cause varicose vein. Another one is tumor. Tumor can press the vein as well. Another one is ascites. What is ascites? Ascites means accumulation of fluid in the belly. That will also compress. Another one is prolonged standing. Prolonged standing will cause, like this is a physiological cause. Prolonged standing, there is a gravitational force, of course, pulling the blood down. And against this gravitational force that is actively pumped up, the blood is actively pumped up through the muscles. Muscles will contract, and blood will go up. But on prolonged standing, muscles will get fatigue, and blood will gradually come down, and that will cause varicose vein. So this prolonged standing, so mostly varicose vein are seen in watchmen, and one who is doing a job that requires him or her to stand for a long time, like for example chef. Okay, so these are the four causes. One is defect in valves, another one is defect in perforator vein, another one is defect in saphenofemoral junction, and another one is defect in deep vein. This four one, each one has a different treatment. We'll see that. Okay, now what are the clinical features of varicose vein? There are four basic clinical features. One is dilated and tortuous vein, which I've told you that appears through us from outside. That is the tortuous and dilated vein. Another one is dull aching pain. What is dull aching pain? So when you press that area of dilatation, there is a dull pain, not a sharp one. Okay. Another one is corona phlebitica. What is that? So that is spider vein appearance near the ankle, because ankle also has superficial veins, and blood, if blood is accumulated there, they are in the shape of, you can see, spider like you can see like this, So that is known as corona phlebitica. And another one is atrophy blancae. That is the depigmentation. In some cases, you can see depigmentation like this near the ankle. So these are the four features of varicose vein. Okay. Now let us go through the investigation. Like how will you investigate varicose vein? So mostly it is clinical. Just by looking, you can say this is varicose vein. But varicose vein has four causes. We have to identify which one has caused varicose vein out of these four, and for that we have clinical examination. Apart from clinical examination, you have ultrasonography and venography. Okay, so what is venography? Sonography, you know, that is most common. Now what is venography? So in venography, what doctor does is they inject contrast inside your vein, and then they look through through X-ray or through sonography. So if there is any defect in the vein, you'll come to know. Okay. The most important ones are clinical examination, and these are being also asked during practical for final year MBBS. The first one is Trendelenburg test. So what we do in Trendelenburg test? First of all, we lie a patient in a supine position and we lift both their legs, or you can also lift one which has problem. So what will cause is it will empty the leg. I'll empty the leg with blood. So when you lift, of course, when you lift the leg, of course, there will be less blood going through it, and through that we can empty the blood vessels. Now, once you have emptied the blood vessels, you tie a tourniquet. What is tourniquet? That is nothing but like dupatta or anything which you can tie at saphenofemoral junction, where deep vein and superficial vein meet. Now, ask the patient to stand up. Okay, let me explain you through this image. Ask the patient to stand up. Now, we have emptied, okay, now we have emptied this blood vessels. There is no blood inside, and we have put a tourniquet here. Like for example, this is a leg. Okay, this is a leg. So we have put a tourniquet. हमने बांध दिया यहाँ पे. So what will tourniquet do is that it will obstruct the superficial vein. It will obstruct only superficial vein. If you tie dupatta on your legs, it will only obstruct superficial vein. It will not cause any harm to deep vein, because deep vein is between the muscles. Okay, so once you have tied a tourniquet here, and then you ask the patient to stand up, what will happen? Of course, the blood will come down through deep vein because deep vein is not obstructed, but blood will not come to superficial vein. That is the use of this test. But what if blood comes to the superficial vein? There is a problem. Okay, so here I've written empty leg and tie tourniquet below saphenofemoral junction and ask the patient to stand up. Now initially don't open the tourniquet. If there is a gradual filling from below, मतलब नीचे से ऊपर भरते भरते blood आ रहा है, then there is a problem in perforator. I've told you, like, let me show you. Here we have tied, there is no blood inside here, but even if the blood comes, that means there is problem here. Blood is coming like this. Okay, blood is coming from deep vein to superficial vein. Ideally that should not come. Ideally blood only goes from superficial vein to deep vein. But if there is a problem here in the valve of perforator vein, blood comes to the superficial vein and it gets filled up from below above, and you get varicose vein. Okay, now what if you open the tourniquet? If you open the tourniquet, आप दुपट्टा खोल दो. If the blood fills up suddenly, normally only blood goes from superficial vein to deep vein, but if you open the tourniquet and you see a filling effect from above downwards, that means problem is here. Blood is going from deep vein to superficial vein. That means problem is in this junction. Yes, so we have discussed two causes. One is in perforator, another one is at the junction. So this Trendelenburg test tells us whether problem is in junction or perforator. Okay, here I have written open the tourniquet, rapid filling from above. Saphenofemoral junction incompetence. Incompetence simply means the entity is not competent. Muscle incompetence means muscle is not competent to work. Uterine incompetence means uterus is not competent. You will not get pregnant. So that is the incompetence. Saphenofemoral junction incompetence. Now let us discuss two more tests. We have actually four tests. Okay, and these both are tests for saphenofemoral junction incompetence. One is Schwartz test. If you tap over incompetent vein means one that is visible to you dilated. So if you tap over that and if you feel the thrill at the saphenofemoral junction, then saphenofemoral junction is incompetent. That is the Schwartz test. Another one is Morrissey cough impulse test. In this, you ask the patient to cough, and if the cough impulse is felt at saphenofemoral junction, then also saphenofemoral junction is incompetent. So these two are the test for saphenofemoral junction incompetence. These two are not done because Trendelenburg test is done nowadays, and that tells you whether the problem is in junction or perforator. So we have discussed two causes. One is for like the diagnosis for perforator. Another one is the diagnosis for junction. For junction, there are three tests. One is the Schwartz test, Morrissey cough, and earlier we have discussed this Trendelenburg. So three, anyone we can perform. Trendelenburg is easy one. Now Parthis test. Now this is for diagnosing problem in deep vein. So tie tourniquet below saphenofemoral junction. Then you ask the patient to walk. Normally, like you, me, you don't have varicose vein. So what will happen? Nothing. Even if you tie the tourniquet, that will going to affect the superficial vein. And I've told you that superficial vein, whether it is present, absent, doesn't make any sense. What is important is deep vein. Now for us, deep vein is functioning normally even if you tie dupatta. So there is no swelling. But what if there is a blockage in the deep vein? Let me tell you. Okay. Now, for us, even if we tie tourniquet, the blood is going to go up. No problem. Now, what if you tie tourniquet and also there is a blockage in the deep vein? That means blood will not go up. Also, if we have tied a tourniquet, that means this is also not functioning. So what will happen? So blood will go from here, it will get accumulated here. Okay, blood will go from here because it is not going to, like it is not going up. There is a blockage. So that is why Parthis test is used to diagnose whether we have problem in the deep vein or not. Parthis test. Okay. So one is Trendelenburg test, Schwartz, Morrissey cough, and Parthis test. Parthis test is for deep venous thrombosis, like problem in the deep vein. And in that we ask the patient to walk. Okay. So these are the four tests. Now comes the main thing, management. How will you manage? So for different causes, you have different management, as I've told you earlier. Okay. So what if there is a problem in saphenofemoral junction? Okay. So for that, we have Trendelenburg procedure in which we ligate saphenofemoral junction. As I've told you earlier that we don't want superficial vein. Superficial vein is not at all important. So let's remove that or let's tie that. So here you have, this is deep vein, this is dilated superficial vein and it is connecting to it through at the junction. Now let us tie this with a thread as near as possible to the junction. If we tie, that means blood is not going to, the blood is not going here. So naturally where varicose vein will get treated. So this is one procedure. Another one is perforator incompetence. What if there is a perforator? If there is a problem in the perforator and we tie here, that is not going to make any change because perforator is there here and that will allow the blood to come. So for perforator incompetence, the surgery is different. In that, we do Dodd-Crockett surgery. These are the names of scientists. You don't have to remember names. For final year MBBS, if you're a medico, then you have to remember because you have to write this in your exams. We have Dodd-Crockett surgery and another one is SEPS, subfacial endoscopic perforator surgery. In that, what we do is, here you can see, this is deep vein, this is superficial vein, and this is perforator. You cut the perforator or you tie the perforator. That's it. Both these surgeries are like the procedure is almost the same. The principle is same. Procedure can be different. I have not seen this surgery because I am also a medico. So principle is same, that you tie or cut perforator. This is done like this endoscopically. Okay. So that is the second. We have seen problem in perforator. We have seen problem in saphenofemoral junction and their treatments. Now another one is, these are two more methods. One is endovenous glue therapy, and in that glue is cyanoacrylate. And fourth one is foam sclerotherapy. Again, third and fourth, these are the principles are same, but procedure or material used may be different. What is the mechanism? We inject, like you can see, this is the gun. You can see this is the gun, and we inject a material inside dilated vein. We inject, this is the material. And what will this material do? It will shrink the vessel. Earlier I've told you these vessels are not at all important. So even if it is present or absent, doesn't make sense. So what if we shrink them? So this material, cyanoacrylate, will shrink, will cause shrinkage, and that will heal varicose vein. There are also some prophylactic measures like you wear stockings. You wear stockings. You can search on Google what are stocking garments. So these are the management. We have seen cause, how varicose vein takes place, what are the four different mechanisms, and what are its treatment, how to diagnose as well. So if you like this video, subscribe, because I've seen 87% of the viewers are not subscribers. So if you subscribe, that will help me out to make, that will inspire me to make more videos. Okay, thank you very much.